Yalamadith, everyone, and welcome. My name is Nurani Madani, and I'll be moderating today's Fields of the Future speaker series, exploring the CRNA role or Certified Registered Nurse Anesthetist role. A little bit about me. I am currently a family nurse practitioner working in New York City, and I work for a health tech startup. The Fields of the Future series is hosted by the AKEB Education Board with the aim of exploring career paths, innovation, and opportunities in selected fields of the future. As for today's edition, we will begin by reflecting on knowledge society and the purpose of education in Islam. At this time, I would like to invite Zora Gokul, our Fields of the Future team member, to share this reflection. Zora.
Yeah, Alimadat, everyone. Welcome to the 7th episode of the Fields of the Future series. My name is Zora, and I serve as a team member for the Fields of the Future of the AKEB Education Board for the United States. Before we begin the event, I would like to refresh the Jamaat's memory about knowledge society and the purpose of education in Islam. AKEB highlights the purpose of continued learning at AKEB Academy, Mozambique on June 25, 2004, in which he said, quote, "In the Islamic tradition, they viewed the discovery of knowledge as a way to understand, so as to better serve God's creation, to apply knowledge and reason to build society and shape human aspirations," end quote. How does understanding the purpose of knowledge discovery help us understand knowledge society? It tells us what the two critical attributes are of true knowledge society leaders. First, to discover new knowledge, which is related to the first purpose of understanding God's creation. And the second is to share and apply new knowledge, which is related to the second purpose of serving God's creation. Hazrat Imam at the Aga Khan University Convocation Address on 6 December 2006 explains that these attributes will be of the utmost importance in the future, and I quote, "All of these changes suggest that we are moving into a new epoch of history, a new condition of human life. Many observers describe this new world as the knowledge society, contrasting it with the industrial societies or the agricultural societies of the past. In this new era, the predominant source of influence will stem from information, intelligence, and insight, rather than the physical power or natural resources. This knowledge society will confront people everywhere with new challenges and new opportunities," end quote. Now, some of us might be wondering, does this purpose and these attributes match what the rest of the world thinks about knowledge society? According to the definition outlined by the United Nations, UNESCO, knowledge societies have capabilities to identify, produce, process, transform, disseminate, and use information to build and apply knowledge for human development. This definition matches exactly what our beloved prophets and imams have taught for centuries. What underwrites the ability to contribute to the knowledge society? Hazrat Imam has said at Kyrgyz Republic, and I quote, "There is no better investment that individuals, parents, and the nation can make than an investment in education of the highest possible quality," unquote. Education of the highest possible quality can benefit us in so many ways. It allows us to acquire the newest knowledge. It provides students with a competitive advantage within global societies. It prepares us for leadership in the knowledge society. It provides the fundamental skills that will allow us to participate in fields of the future and to transition between careers. Therefore, I would like to encourage the students of our Jamaat to aim for education of the highest possible quality, as there is no better investment than education. Lastly, I would like to thank the students and the Jamaat who have attended these series. These events wouldn't have been successful without your participation and support. I would also like to take this opportunity to thank the team and partners for all their hard work in organizing these events. Now, I would like to hand it off to Nurani to introduce our speaker for this afternoon.
Thank you, Zora. Now that we have had an introductory understanding of some of the relevant concepts, let's meet our speaker for today. Sanaa Mohammed is a certified registered nurse anesthetist, or CRNA, at Mayo Clinic located in Phoenix, Arizona. Prior to this, she was a registered nurse at the UCLA Medical Center in the ICU for over 3 years. Sanaa has dedicated nearly a decade of her life to evolving within the nursing profession. Upon the completion of her undergraduate degree at the University of California, San Diego, she continued on to Roseman University in Henderson, Nevada, to obtain her nursing degree. After obtaining experience within the ICU, Sanaa pursued her master's degree in nurse anesthesia from Samuel Merritt University in Oakland, California. In addition to her work, Sanaa serves as an adjunct faculty member for the University of Arizona's College of Nursing and is also currently pursuing her doctorate degree in nurse anesthesia practice. Welcome, Sanaa. Before we begin, I would like to encourage our audience to ask questions throughout the session. You can do that by using the Q&A feature of Zoom and entering your question there. The upvote feature is enabled, so if you have the same question as someone else, please like it and it will rise to the top of the Q&A box. Our team will be noting the questions to be asked during the Q&A session towards the end. The recording of the session, along with the presentation, will be shared on our website, fieldsofthefuture.com. And now, without further ado, our speaker, Sanaa Mohammed, will speak to us about her career path, new opportunities within her field, and how this field will evolve with the future. With that, I would like to hand it off to Sanaa.
Thank you, Nurani, for that introduction. And good morning to everyone. My name is Sanaa Mohammed, and I'm a certified registered nurse anesthetist, or CRNA for short, and I get the pleasure of guiding you through my professional journey today. So before we begin, I would like to take a moment to thank AKEB and the whole Fields of the Future team for working so hard on this series. The work that they have done has been nothing short of amazing. But I would like to start off with a few poll questions so we can get a better idea of who's joining us today. How would you classify yourself? Are you a high school student, middle school student, undergrad nursing? Let's see who's out there. All right, we'll give it a couple more seconds. All right, perfect. So it looks like we have a pretty good mix of people today. We have some medical professionals, non-medical professionals. We're kind of everywhere with that. So we'll try to keep this as general as possible so it helps everyone out today. Next question. Have you guys heard of a nurse anesthetist prior to this series? And don't worry, I will not be offended if you say no. All right, so it's a good amount of people, and there's actually more people than I thought that would have, so that's good to hear. Next question that we have for you. Have any of you received any kind of anesthesia before? All right, perfect. So as we can see that, there's 66% of you that have gotten some sort of anesthesia. Almost all of you have known at least one person that's gotten anesthesia in their lives. So as we can see that whether or not you end up becoming a nurse anesthetist, this evolving field has a high potential to influence your healthcare in the future if it hasn't already yet. So the most frequent question that I do get is, what is a CRNA? A CRNA, or a Certified Registered Nurse Anesthetist, is an advanced practice registered nurse, also known as an APRN, who administers anesthesia to patients, typically during surgical, diagnostic, or obstetric procedures. We also help with pain management and provide other emergency services. Basically, we give you all the good stuff to keep you asleep, relaxed, and pain-free while the surgeon does what he or she needs to do. It is a type of nursing specialty where nurses have to work in an intensive care unit for a few years before they go through a rigorous schooling process to obtain their master's or doctorate degrees in nurse anesthesia. You may see CRNAs in hospitals, same-day surgery centers, procedural suites, dentist offices, and pain clinics. Another type of anesthesia provider you may come across is an anesthesiologist, who is a medical doctor that specializes in anesthesia, who we also refer to as an MDA. CRNAs and MDAs can either work independently, together, or together in teams, depending upon the hospital that you work in. I will talk a little bit more about the distinctions and the roles later on in the presentation. So let's start off with what a typical day, a work day, looks like for me. I get to the hospital in the morning around 6:30 and I get to change into my scrubs. I get to a computer and I figure out my caseload for the day. I figure out the kinds of cases that they are going to be, what type of anesthesia they'll most likely need, and consider if they will need any extra monitoring or any special medications. I set up my airway equipment, medications, and check my anesthesia machine to make sure it's all working well. And in that picture, you can kind of see in the background to the left of the provider what my anesthesia machine looks like. I also always make sure that I have easy access to my emergency medications and always have a backup airway plan. In our world, we don't just have a plan. We have a plan A, plan B, and a plan C ready to go just in case. Next, I go talk to the patient I'll be taking care of. I make sure I thoroughly understand their history, medication record, allergies, and prior surgical history. I discuss with them the game plan for their care. Oftentimes, people are told they're going to surgery, but are not told exactly what to expect. I take the time to explain to them what will happen from the moment they leave the preoperative room that they are in to the operative suite, all the way up until the time they go to sleep, and then what will happen once they get to the recovery room. This is a very, very important time. You are meeting a patient, most likely for the first time, and within 5 to 7 minutes, you have to not only gather their history and make sure your game plan still fits the patient, but also make sure that the patient is comfortable and you gain their trust. I make sure that they have all their questions and concerns answered before we head back to the OR together. Once we are ready to go, we take the patient to the operative suite and we do whatever type of anesthesia is required for the patient and continue to monitor them throughout the procedure. We may add or take away certain medications depending upon what works for the patient. You may not know how a person reacts to certain medication until you give it to them, so we have to be constantly vigilant, and you may need to change the game plan based on how the patient does. Upon completion of the procedure, the patient wakes up and gets taken to the recovery room where we make sure that they are comfortable before leaving them in the care of the recovery room nurse. I finish off any remaining charting for the patient and then shift my full attention to getting ready in the same way for my next patient. So here are a few skills that I believe get used every day in our field. Complex multitasking is huge. Multiple times a day, you are pushing meds, placing an airway device for a patient known as intubating, watching the IV line, listening to vital signs, interpreting and treating all of this based off the patient's comorbidities all at once, all without getting overwhelmed. The second is the ability to deal with high pressure. In times of crisis or codes, people will need to look at you for answers. When a patient's heart is slowing down in front of you or jumping into funny rhythms, you have to be able to manage that issue swiftly and without panicking. Leadership. As an anesthesia provider, you will help set the tone for the room. If you panic, those around you will panic. In tough situations, you must also know how to appropriately delegate tasks and know what will be an efficient and effective intervention at that time. You will have to be knowledgeable about the medications and certain disease processes. I have had surgeons turn to me in the middle of a procedure asking if that patient can get a certain medications or what the appropriate dosages are. You have to know the answer. And if you don't, you need to know where to get those answers quickly. Advocacy. You need to have the bravery to stand up for your patients, especially if you see something that may potentially harm them. Even if that means you are saying no or stop to a world-renowned surgeon that has been practicing for over 20 years. You have to do what is right for your patient at all times. Another trait is being a curious and lifelong learner. Every 4 years, you will have to do a set of continuing education units, and you will have to keep up with those in order to keep your license active. And these last two, I feel, are huge. Intellectual humility. You can try to learn anything and everything available to you, but you will never know everything. There will always be new medications, procedures, or disease processes to learn about. Never assume that what you know is final, and you must always be willing to accept this new information and adapt it into your practices. Personal humility. You are taking a person's life into your hands and sometimes bringing them pretty close, like an inch away from death. It's an honor that someone trusts you that much, but you cannot abuse that trust or take that trust for granted. So what does the CRNA field look like? To date, there are 57,000 CRNAs. 54,000 of them are active CRNAs and 3,000 are inactive or CRNAs in training. There is a projected growth of about 26% over the next 8 to 10 years, which is well over the national average for other professions. There are a few key factors that are driving this growth. Mostly, there's a shift in patient population where they are getting older and sicker, and there's simply just not enough anesthesia providers available to meet the need. More advanced practitioners are needed to help handle higher acuity cases in a growing number of locations. Another factor is the need for increased access to care, especially in rural areas. CRNAs represent more than 80% of the anesthesia providers in rural counties. Many rural hospitals are in critical access hospitals, which often rely on independently practicing CRNAs for anesthesia care. Half of US rural hospitals use CRNAs only for obstetric care, and CRNAs safely deliver pain management care, particularly when there is no physician providers available, which save patients long wait times and commutes. There is also a huge CRNA presence in the military. During World War I, nurse anesthetists became the predominant providers of anesthesia care to wounded soldiers on the front lines. Today, CRNAs have full practice authority in every branch of the military and are the primary providers of anesthesia care to military government personnel and front lines, Navy ships, and aircraft evacuation teams around the globe. So now that we have talked about the outlook, let's rewind a little bit and talk about how we got here in the first place. So I want to take some time to explain our history because I'm quite proud of it. Nurse anesthetists are the first healthcare providers to dedicate their time to the specialty of anesthesia, existing even before anesthesiology became an option for medical doctors. They have their roots in the 1860s, when nurses first gave anesthesia to wounded soldiers on the battlefields of the Civil War. In 1909, the first organized program for nurse anesthesia education was offered. In 1952, an accreditation process for nurse anesthesia educational programs was started and have been recognized in the US Department of Education since 1955. In 2001, due to the scarcity of anesthesia providers, changes in centers for Medicare and Medicaid services were made, making it possible for CRNAs to practice independently and get compensated appropriately for it. This was a huge win for CRNAs, and it became a driving force for hospitals to hire more CRNAs. When I say practice independently, I'm referring to the different practice models that CRNAs and MDAs work in even today. So these are the 3 different practice models that will show how CRNAs and medical doctors may work together in different cases. The clinical practice that you have depends upon what state you live in and what kind of practice your hospital chooses. Federally, CRNAs are independent providers. They can do anything an anesthesiologist does. Like I mentioned before, in the military, all deployed CRNAs work to the full scope of practice. Depending on the state and the hospital you are in, you tend to follow one of 3 models that guide practice. The strictest of all is the directed practice. MDAs, or the medical doctors of anesthesia, overlook 2 to 4 rooms being run by CRNAs, and the doctors should be present for all critical events, such as when the patient is going off to sleep. They do not necessarily stay in the case, but periodically come into the surgical suite to check in on how the case is going and to be there for any critical situations that may arise. Independent practice is when the CRNAs and the MDAs work side by side and have the same exact role. They all just work in parallel and take care of their own patients. Supervised is somewhere in between, where the MDA is there for extra hands if anyone needs it. They overlook 3 to 5 rooms run by CRNAs at once, so they won't necessarily be there for the big events, but they're just there to offer extra hands or a different perspective if needed. Being aware of the different practice models while in school was important to me so that I could help guide my learning and gear myself up for a more independent practice. Having autonomy in my practice was very important to me because if I learned the skills, then I wanted to be able to use them. So here is a visual to show which states have opted out of mandatory physician supervision for CRNAs, meaning that by state law, a CRNA can practice independently. The aqua colors for the states that have opted out versus the gray states are ones that require some sort of physician oversight, not necessarily by an anesthesiologist, but any physician. It can even be the physician that's performing the procedure in the room. More and more states are realizing the increasing need for anesthesia providers and are changing laws to increase access to much needed care. So let's go through my journey. My parents, so for high school, my parents enrolled me in an IB program, which stands for International Baccalaureate, and it is a globally recognized advanced curriculum. Unlike AP, where you pick and choose individual courses and test to get college credit, IB credit is a full 2-year program where you take honors type classes in different subjects from a more globalized view. Similar to AP, the students take tests at the end of the year to convert those courses into college credit. Additional extracurricular activities that I did during this time were being on the executive board member for the Red Cross Leadership Camp, playing field hockey and basketball, volunteering at special needs schools, and I taught an SAT prep course through Kane. At this time, I was not sure what I wanted to do professionally, so I just applied to a couple different universities and hoped for the best. Of the schools I got into, I tried to figure out what would make me happiest. I picked it out based on rankings for degree programs that piqued my interest, but I knew that I had to do some soul searching to really figure out what I wanted to do professionally and what would make me the happiest. I felt University of California, San Diego gave me the best breadth of options to explore. I started with a degree in psychology, but I knew that I would need to get creative to figure out how to apply it to a career or end up getting a second major. By summer of sophomore year, I really just took that summer to explore what I needed. After doing tons of research, I decided that what I wanted to further explore were options in the medical field. I found a good option through UCSD where I could do a public service minor and they would help me get volunteer hours in a hospital for school credit while I figured out where I saw myself in the medical field. I was placed in different units such as oncology, recovery room, and cardiac, where I got to interact with a lot of different professions. I talked to doctors, nurses, physical therapists, hospital administrators, so many different people at all different levels. I also got to work with patients where I helped with basic care and transportation. This is where I fell in love with nursing. I met so many nurses that were so smart, genuinely caring, and loved what they did. I learned that they did a lot more than just passing out medications that someone else prescribed. What was more important to me was getting that time to spend with a patient and being given the opportunity to really impact their experience at the hospital. What I also appreciated was learning about the diverse roles that a nurse can be in. One could be a bedside nurse in different specialties, be in an ambulatory clinic, a nursing administrator, home health, dialysis, working on patient experiences. The possibilities are endless. The concept of nursing informatics is what really blew my mind. Are you a nurse but don't want to work with patients anymore? No problem. Nursing informatics is where you help with bridging the technological gap between what a nurse needs versus helping an engineer create a practical solution for it. It's brilliant. I figured that going into nursing would give me the flexibility of being in a strong, well-prospective and growing field while giving me professional freedom. Once I decided to do nursing, I had to figure out the next daunting task of how to get into nursing school. Ironically, I chose UCSD for my undergraduate degree because it gave me the option to join a wide variety of programs, but it did not have a nursing school. So I had to start figuring out my next steps. That gave me two options. Either I graduate from UCSD early using the college credits I got in high school and then apply to another school to get my Bachelor's of Science in Nursing as a second degree, or I try to do a lateral transfer to another school without a degree and try to get into the nursing program. Many of the nursing programs I looked at locally had a 2-year waiting period as a lateral transfer. So I opted to graduate from UCSD within 3 years with a Bachelor's of Arts in Psychology and a minor in public service while starting to work on my prerequisites for nursing school. This led me to San Diego Community College. In 1 year, I finished all my nursing prerequisite courses and got my EMT certification to help buffer my nursing school resume. It also gave me an option for a health-related job I could do for a year, just in case I did not get into any nursing schools that I applied to. Luckily, I got into a couple schools on my first round of applications. I narrowed down my schools based on duration of program as well as how soon it started. That is how I landed on Roseman University of Health Sciences in Henderson, Nevada. It was an extremely rigorous second degree program that condensed a 2-year workload into 14 months. Prior to graduating, I started applying to new graduate nursing preceptorship programs at hospitals. These are 6 to 12-month immersion programs run in the hospital where you get hired into a specific unit and they help you adjust to the pace of working in that hospital. Prior to graduating, I got an offer from UCLA for a position in their intensive care unit. They have a wonderful new graduate transition program where they set you up with a mentor and extra resources for a full year of support. Within a short period of time there, I got trained onto specialty teams to take on sicker and higher acuity patients, such as intra-aortic balloon pump patients and those needing continuous renal replacement therapy. I started to precept bachelor's and master's level nursing students that are coming in for clinical rotations. I got trained to be a resource nurse for the floor, and I also joined quality improvement teams to reduce the incidence of hospital-acquired bed sores. I started a research study on how to reduce delirium in the patients in the ICU, which is an increasing problem that we're seeing as patients are staying longer and longer on the unit. I then started working towards getting my CCRN certification, which is a specialty certification for nurses who provide direct care to acutely and critically ill adult patients. After being here for a little bit, I started to think, what's my next step? Am I happy here? Yes, but do I see myself doing this for the rest of my life? My answer was no. I knew that I wanted to get back to school to get my master's degree, but I was not sure what I wanted to specialize in. I decided to speak to nurses in different branches of advanced practice nursing, known as APRNs. What are the different types of APRNs, you ask? Let's take a look. There are 4 types of advanced practice nurses. First one I looked at was a nurse practitioner. They focus on diagnosis, health promotion, disease prevention, and health education. They can specialize in areas such as acute geriatrics, acute care, geriatrics, emergency, primary care, and pediatrics. Although this seemed like a good option, I wasn't thrilled with the idea of the long-term care aspect that comes with being a nurse practitioner. Next, I looked into what a clinical nurse specialist does. A CNS is an expert in a specific patient population, such as pediatrics or critical care. They often function as educators and consultants to the nursing staff and as experts on evidence-based practices and quality assurance. I liked the idea of being an expert in the field, but I knew that I would have to give up the patient interaction aspect and take on a more administrative role, so I knew that that wasn't for me. Third, there's a certified nurse midwife. They focus on women's health, specifically the pregnant ladies. They mainly concentrate on pregnant women from labor and into delivery and then help them out in the postpartum period as well. It was nice to see that they formalized the role and education of a midwife, but I wanted to be able to work with a larger population of patients. Next, I looked into what a CRNA does. I saw that they are experts in anesthesia, pain control, and airway management. They can work in a hospital, pain clinic, ambulatory clinic, dental offices, and so much more. So I went to nurses that were in these positions and I asked them how they liked their jobs, what their school process was, and what their day-to-day looked like. I was even able to shadow an NP, a CNS, and a CRNA. I spent the day learning more about what they do and why they chose to follow that particular path. By the end of my experiences, I was most intrigued by the CRNAs. They get the opportunity to intensely focus on the care of one patient at a time while doing a bunch of fun skills and procedures. Needless to say, I fell in love with the profession. So I went back and I started to research what my next steps would be. In preparation for CRNA school, I took my GREs and talked to other people that I knew had left my unit to go to CRNA school to see what their experiences were. I also noticed that some schools required that prerequisite science courses had to be completed within the last 5 years before program entry. So I started to retake my chemistry courses. I also continued to volunteer in a couple opportunities I came across, such as being a camp nurse for Camp Mosaic and for the Special Olympics when they were held in the LA area. After being in the ICU for 3 years, I got into a few anesthesia programs and I chose Samuel Merritt's University of Nurse Anesthesia program. The factors that helped me decide which program to go to was the type of degree I would come out with and whether it would be a master's degree or a doctorate degree, duration of the program, tuition, types of clinical sites I would rotate through, and the proximity to my emotional support system. After a very grueling 27 months, I finally graduated. It was definitely the most emotionally and physically difficult period of my life, but looking back, I know it was definitely worth it. Right after graduation, I received an offer to be a CRNA at Mayo Clinic Hospital in Phoenix, Arizona. Before turning down other offers, I took a minute to figure out what the hospital would offer me. Anesthesia-wise, I looked at, did they have any opportunities for me to run studies? I really enjoyed that while I was in the ICU. Another important aspect was that certain hospitals may not let CRNAs do bigger cases, but Mayo created special teams where if you were trained in them, you were put into these larger cases. Non-anesthesia things that I looked at, and I suggest anyone to look at when looking at jobs, is what does your hospital do in regards to community involvement and volunteer opportunities? To look at the teamwork and camaraderie among staff members. What kind of quality of life will you have? For me, I looked at the shift schedule as well as the on-call schedule. I looked at the hospital and job stability. Mayo Clinic has a strong standing history and it continues to grow larger, showing increased need for anesthesia providers. Other stuff to look out for includes additional benefits. In addition to income, what else are they providing you? Do they give a pension? Do they cover malpractice insurance, 401k or 403b matching? Do they support higher education by helping employees go back to school? All of these factors helped me decide if this hospital was right for me. While being here, I received additional opportunities like joining those specialty teams and precepting CRNA students, joining a task force to help set up the COVID surge ICU beds, and then later being a provider for those beds. All of these experiences added to my resume, and I was able to obtain the title of adjunct faculty for University of Arizona's College of Nursing. After being at Mayo Clinic for 2 years, I decided it was time to go back to school. A few months ago, I got admitted into the Missouri State University Doctorate of Nurse Anesthesia program, and I'm extremely grateful for the opportunity to continue my studies while working full-time. Although this is the journey that I decided to take, everyone's path will end up being a little different. Needless to say, every journey will also have a few roadblocks and setbacks. So now I get to tell you all about mine. The first setback I had was an internal one. I felt pressured because I thought I chose the nursing profession late and that I was falling behind compared to other peers. I decided it almost in my 3rd year of college, where I was already in a university that didn't offer a nursing program. My other friends would be graduating soon and starting their professional careers, while I easily had a few more years to go before I got out into the workforce. I did a lot of research to figure out how to get caught up and be the most efficient with my time. I started prerequisites at San Diego Community College while still being at UCSD to get that knocked out. I picked an accelerated program versus a 2-year program to get my BSN. I had to weigh out what was more important for me at that moment. Did I have the resources to support myself and shut down my whole life for those 14 months just to focus on school? Or did I have other pressing responsibilities that would require me to balance out life with a 2-year program? Or should I take an even longer program, a part-time program where I could work and go to school simultaneously? Everyone's situation is a little different. It does not matter if it takes you a little bit longer. The point is to get there in a way that makes sense for you. We had a person in the accelerated program, single, no kids, no dependents, no parents that were dependent on them, no house mortgage, nothing to worry about. All they had to worry about on paper was getting through school, but the school pace was very vigorous. They had decided to decide that either they risked flunking out of the program altogether or changing to a 2-year track. They opted to slow down and take a little bit more time for their studies, and now he is a successful nurse. On the other hand, we had someone with 2 kids who decided that it was in their family's best interest for them to just grind it out and be a little absent for the family for a little bit, but to finish as soon as possible. And this person graduated near the top of his class. It all depends upon what you need as a person, and only you can judge what's best for you. You cannot let other people tell you what works better. Overcoming that thought process helped me conquer what I felt was my first setback. As for my second setback, I did not get into my top choice for CRNA schools. I only had 2 years of experience at the time, so I knew the probability of me getting in was low in such a competitive program, but I figured it would be helpful to at least try to get a better understanding of the process. In fact, when I got rejected, I made an appointment with a counselor to figure out what I could do to bolster my application for the following years. I drove almost 2 hours in traffic to meet with the counselor face to face. Within 2 minutes, he flat out said not to bother with CRNA school at all because no one would accept my BSN because I took an accelerated program. I was crushed. I went home and I did some more research, and I was wondering how I missed such a glaring detail. After looking into the program's website and that of other schools, I realized that it was not an issue that anyone else had mentioned anywhere. I reached out to a few other schools whose programs aligned with what I wanted and asked their views on accelerated BSNs. No one else had that issue. In fact, some counselors said that if nothing else, it proves that I could handle the pressures of being in a rigorous program. The following year, I applied again and got into 3 programs. From there, I chose one that was best for me. Oddly enough, looking back, I'm thankful I ended up going to the program that I chose because their clinical sites and teaching styles better fit my needs. There is a saying that our program director used to say, trust the process. I'm so thankful to be where I am today, but in addition to all the research and footwork that I put in, there's a little bit of trust that you have to place in the world and that things will work out the way that they did for a reason. All the setbacks can really weigh a person down, but in these moments, it's important to be able to step back and remember what drives you and why you do it. So for me, those are my internal motivators. What motivates me? For me, it's the satisfaction of helping people. I like knowing that I played a part in making someone's procedure or experience better. I have people coming in that have had traumatic experiences with prior anesthesia, and I take it on as a personal mission to ensure that they have a much better experience this time. I like the challenge of solving puzzles. The human body is a fascinating machine, and I love understanding the intricate aspect of how it works and helping figure out why it may not be. Why is the blood pressure low? Why did the heart rhythm change? What can I do to change that? There's a continuous thirst for knowledge. It ties into my desire for solving puzzles. Every day I tell myself that I want to learn or review one thing. That's how I make sure that I have all the pieces available to solve those puzzles. I also enjoy the thrill of accomplishing the technical skills. There is a sense of excitement that sparks when you get that difficult airway in or you get that spinal block in. It's quite exhilarating and fulfilling. And when I say fulfilling, I mean really fulfilling. I picked up a second job where I get to work in obstetrics just to do spinal and epidural blocks for the pregnant ladies because it genuinely brings me that much happiness and satisfaction every time I place them. I also appreciate getting pushed to think out of the box every day. Every day is a little different. Every body is a little different. What you did yesterday on a patient getting the same procedure done may not work for your patient today. It's not just learning to utilize all the tools in your toolbox, but finding opportunities to expand that toolbox as well. I also appreciate the excitement of every day being a little different. Every day looks a little different for me, whether it's the location I work in, the type of cases I'm doing, the patient's comorbidities, or the tools I have access to. I actually worked in a marketing job for a summer while in undergrad, and I just could not wrap my head around sitting at a desk and staring at a computer every day. I knew that that lifestyle wasn't for me. So all that to say that I love my job. I love being a CRNA, and I am so thankful to be able to share this with you all. So thank you all for being here with me today. And of course, in the midst of the pandemic, I just want to take an extra minute of your time. To all the current healthcare workers that are listening in today, thank you. To all the people that have helped the healthcare workers do what they need to do, the support staff, friends, family, public health groups, you are so appreciated. We have fought long and hard on the front lines here in the last 14 months, and it hasn't been easy. But I am thankful and honored to work alongside each and every one of you. And with that, I'm here for any questions. Please feel free to email me with any questions you have, or you can add in the questions in the Q&A box and we'll get to them soon. Thank you.
Thank you, Sanaa. Thank you so much for sharing your field of the future with us today. I genuinely, because I can relate to the field, obviously, enjoyed learning about how widespread this field is and so many opportunities. Actually, in particular, I enjoyed learning about how old the CRNA field is. I mean, for someone who's also in the field of nursing and as a nurse practitioner, I didn't know that CRNAs dated back to the Civil War. Like I thought that was just nursing. So it was quite cool to learn about that. With that, I will open the floor for questions. As I mentioned earlier, you may submit questions using the Q&A feature. And actually, I'll start with one here. So, I think like the one thing that you talked about was that the CRNA role is high pressure, high intensity. And I think nursing in general can be, depending on the setting you work in. How do you deal with hard days? Like, what do you do to cope with hard days? And how do you, like, especially with COVID, how do you pull up your socks and go back into the field and still maintain that sense of, I guess, like joy, happiness, peace, like not being overwhelmed and burnt out, like avoiding burnout? How do you do that? What are some things you do?
So the big things for me is heavily relying on my emotional support system. That's why one of the first things I did was thanking all my friends and family around me, because I know that when I came home, I'm upset. I'm so overworked with what was going on. A lot of it was being able to come home, vent to my family, just coming home, and my favorite meal is made for me, just as some sort of comfort food. Little actions like that from the family really, really helped me be like recenter myself and feel a little happier about what I was doing. Another thing is just finding physical activities where I could release some of that stress and anxiety. With where I live, hiking's a big thing, going out, going for a walk, just something to physically release that pent up energy that we have is helpful. Another thing is just looking back on those internal motivators that I had mentioned earlier, just taking a second to think, why am I doing this? Like, yes, I had a rough day. I may have a patient that coded. We're in the ICU unit with all these COVID patients, but why am I doing this? I'm doing this because I like helping patients. I like being a part of helping them get better, and just taking a step back and being like, is this still important to me? Yes, it is. Okay, let's figure out a way to work through this anxiety so I can get back to doing what I love doing.
Awesome. That's so great to hear that you have these like coping mechanisms in place, because I feel that sometimes working in high pressure environments, especially in healthcare professions, it's easy to get burnt out if you don't have a place to cope with what you've been through, especially with what we went through with COVID. So thank you so much for sharing that. The next question is, what's the difference between a master's, and this is such an important question, I think it comes up everywhere and in all fields of nursing, especially now that we're seeing like a doctorate level training. What is the difference between a master's and prepared like CRNA degree versus a doctorate prepared CRNA program, and their scope of practice? So is there a difference in their scope of practice?
Very, very good question. So in practice, nothing changes. At this moment in time, absolutely nothing changes. You do the same exact things. In a master's degree program, you are given the ability to practice to the full scope. So it doesn't change what you do in a hospital, but if you want to go back and do research and things like that, that's where the doctorate degree comes in, and it comes in handy. So that's why I was able to get a master's degree initially, start working, and then slowly work on my doctorate degree later. It doesn't change what I do in the hospital, but it changes my ability to help out in the school of nursing that I'm also a part of.
Awesome. Yeah. And I think that's such an important thing to understand. So I think for everyone out there who's considering a doctorate program, just look into what that doctorate program will do for your particular nurse practitioner profession and nursing profession before pursuing it. Great. So the next question is, what is the approximate, and salary comes up a lot of the time. So if you feel comfortable sharing, what is the approximate salary for someone who's starting in this profession?
I looked up the average national stats in preparation for this. So I felt this question coming on. I do believe the national average is about 171,000 per year, but it is dependent on the location that you work and the type of hospital you work in. If you end up and obviously the shifts and cases that you take on. If you work in a more rural area where you're taking on the more independent role and you're doing more procedures, you are going to make significantly more than that. But in situations where you may just, if you want to work part-time, just a couple, just in a dentist office part-time where you don't have to work that many long hours, you're going to end up being on the lower end of that scale.
Yeah. And I think just to piggyback on that is like, and I'll take this like mid-career professionals, and I'm sure you agree with this, it's just going to change and vary where you work, how long your experience has been, and probably will go up as you work in this field. Great. So
just one more thing I wanted to add on to that.
Absolutely.
I know salaries are important for what we do. It is a guiding factor for a lot of the way that we choose what we do and what makes us happy in our professions. But I think it's just important to take a second to point out that what we do here, whether it's nurse practitioner, whether it's NP, CNS, whatever it is, medical doctor, whatever, you cannot go into these practices just for the high income. These are jobs where you need to have the internal drive to want to help people. If you are going into these jobs solely for the salary, you will not be happy. That is how you end up with doctors that are burnt out, or nurses that are burnt out, angry, don't like what they're doing, don't spend the time that the patients need and deserve. So please, please, please consider these fields. They're wonderful, wonderful fields to be in, but only do it if you genuinely have the desire to help people.
That's an excellent point. Thank you so much for saying that, because I think that when I have hard days, that's how I drive myself to go back to work too. Great. So the next question is, what challenges does the CRNA field face? So I think from, I guess maybe even from a day-to-day standpoint, and then maybe even from a larger scale, like what are some challenges going forward that the field is facing?
So our biggest challenge would be, I kind of touched on it a little bit, would just be the interactions between the CRNAs and the anesthesiologists is actually a point that we face frequently. Because although the nurses started doing anesthesia first, it became a more formalized education process after the doctors had done it. So for them, it can sometimes feel like that we're encroaching in on their space, but we don't mean to encroach on anyone's space. We're just trying to fill in a specific need. And Nurani, you can add to this if you want to, but similar with nurse practitioners, the profession was developed to fill a specific need that wasn't being met. Right? We're able to go out into other areas when there's not enough anesthesiologists, where anesthesiologists are not willing to go. And we're able to offer services to people that they may not have gotten access to otherwise. So there is a little bit of a point of contention with some anesthesiologists where they're like, you don't belong. And it's just day-to-day proving that we are well-educated, well-qualified providers, and we are offering a huge service to our patients. And that's what all of this is about, being there for the patient.
Yeah, I think that's a challenge for most nurse practitioners in this field. And it really varies on the state you live in. Yeah. I've practiced in multiple states, and I can say I'm quite happy in New York. But I think it varies. And I think at the end of the day, it's truly just staying true to who you are and keeping your head and just working and keeping patients first. Thank you for that. So the next question is, how many patients do you see on a regular day? So what does your workload look like?
That can actually widely vary, depending upon the cases that we're doing. I get put in a wide variety of cases. I've been in cases that have lasted 12 hours, so I'll start my day and I'll be there for however long I'm supposed to be there. And I may even get relieved by another CRNA working the night shift to take over the case. So there's certain days where I may not even get through a full case, versus if I work in the area where we do endoscopies, which is where they put the camera down people's mouths to take a look at their stomach and their stomach lining, I could do up to 12 cases a day. So it really is just location dependent.
Okay. Yeah, no, great. Thank you for your response with that. This question is important, interesting, but how do you factor malpractice into your practice? So are you concerned about it? Is that something CRNAs, is it a potential thing that you're worried about? And do hospitals, and I'm going to piggyback off of that, do hospitals provide support for that?
So it's very dependent upon the hospital that you choose, which is why I pointed that out, and know what your malpractice coverage and insurance is going to be when you step into that hospital. The main job I work at, malpractice insurance is covered. I don't have to even think about it. Every year they handle the malpractice insurance, they handle the paperwork, they handle all of it. And I know that there's coverage for when the procedure happens. We're covered through there. And if 8 years or 7 years later, they come back and like says, wait, I think I had some residual issues from this anesthetic, I want to try to go sue this person 7 years later, I am still covered by Mayo Clinic because I was there when that procedure happened. So there's that option versus some other hospitals. If you're working a contract job or anything like that, they may require you to get your own malpractice insurance. So in that case, you have to be sure that you pick an appropriate level of coverage that'll cover you the whole time. And that's a whole different line of questioning that if that person wants to ask me about, I can go more in depth with them. I just didn't want to bog everyone down with that information if it wasn't.
No, I think great
but
question.
it's a very good question and very important to look into.
Yeah, absolutely. All right, so the next question is, you mentioned that you can conduct studies. You talked about research and doing research. What kind of studies can you run with your background? And this is, I think, crucial, especially with DNP, PhD sort of. Yeah, so what kind of studies can you conduct? And I guess this person that's asking this question is really wanting to know because they have a research background and they want to be able to incorporate research in their practice as well.
Nice. So what the things that we are doing now in the hospital, we have a wide variety of studies running on, just a CRNA or an MDA or a group of them may just pick up a specific new concept and just run with it and see how it works with our patient population or how it works on our staff. For example, for utilizing lidocaine, opiate reduction methods for pain control. Things like that. So we just ran a study on a small population to see how they react in the case of a certain surgery and if they needed less opiates for pain control after that. So that's an example of a study using ketamine as pain control, different airways that we have, different masks, reducing corneal abrasions, like scratches in your eyes as people are waking up from surgery. It's a sad people can scratch their eyes when they're waking up. So to reduce, I'm trying to make it as easy as possible. Yeah. They're just like things like that, where we just want to improve the quality of care that we provide. And so just running studies to make sure that we're doing the best care possible and see if there's anything else that we should be incorporating. So if you think that it's something that's relevant to our population, why not run a study on it and see what you can do?
Yeah, so I think it's a wild field, it's an open space, finding out what you want to study. And I think if you work in an academic institution, especially, the opportunities are out there. So all you have to do is take the initiative to do so. Thank you for sharing that. This is an important question too. What's the difference between, if you can answer this, say a master's in anesthesiology assistant, so an AA program versus a CRNA program, and how do we pick which one to do?
So the difference between the two is that for a CRNA to become a CRNA, you have to be a nurse, you have to work in the ICU, you have to get some additional certifications done, and you have to go through a CRNA school, which is a nursing school-based program. Right, so that requires some sort of background. You would have had to be in a hospital. You would have had to work with patients. You would have and while you're in the ICU, you would learn some of these medications. You would learn how to use these machines. So you have hands-on experience with what you're going to be working with as a CRNA. An AA program is you're coming in with zero medical experience. There are people that can transfer over from like a business side of a business background, do an AA program, and then get put into the hospital to do some of these things. So you may not necessarily know how these machines work or pumps work or a lot of these medications work until you're kind of in the field. So you come in educationally from two different backgrounds like that. Once you're in the hospital, CRNAs can either work in either like the range of the different practices that I spoke about earlier, whether you can be independent, you can be supervised or directed. There is still an option to be independent where you can practice on your own. As an AA, Because you do not have that history of being in the hospital, there's no potential to be an independent practitioner, and you will always be under a doctor, under an anesthesiologist. So the anesthesiologist will be in there pushing your medications. They will be there as you're waking up. They'll have to be there for all the critical situations. So it's basically falls under a directed practice for them, a fully directed practice. And there's my understanding is there's no option to step away from that as an AA.
Got it. Yep, that's my understanding as well. So thank you. So while with that, we're actually out of time for questions. Thank you so much for joining today, Sanaa. This was truly, I learned so much as well, and makes me realize how wide the nursing field is. And for someone who's been in this practice for a while, I'm still learning too. So
thank you so much for having me here.
No, thank you. And thank you to all our attendees for joining us today. Before we sign off, I'd like to invite you to an event that's hosted by the Ismaili Health Professionals Association and the Ismaili Nursing Alliance. The Future of Nursing event will explore diverse fields within the ever-changing field of nursing. And again, if you feel like you knew everything about nursing, be surprised you don't. So please join us for this webinar. Looking to enter any of these fields, the Ismaili Pre-Health Mentorship Program pairs you with a mentor as well, who can provide you with advice and tips on journey to graduate healthcare schools. Register by emailing ipmpnational@gmail.com. Before we conclude our program, I would like to request everyone to complete a brief evaluation to let us know how we can improve our upcoming events. The link is on the screen, and we will share the link in the chat box. Please take a moment to complete it now. Okay, once again, thank you for joining us today. I hope to see you at our next event 4 weeks from now with Saima Gawani, exploring early childhood development. Thank you, everyone, and Yali Madat.